Hello everyone, hope you're having a wonderful day. It's time to hear about yet another eye condition. As it's Keratoconus Awareness Week, let us know about this. From Pristine Eye Hospitals, founder, director and chief ophthalmologist Dr. C. Jagdish Reddy. Dr. Jagdish, what is keratoconus? Can you tell us a little bit about it?
I think before going to discuss about what is keratoconus, let's tell people what part of the eye is affected. So cornea is the most front part of the eye. So it is the circular structure that everybody notices in others' eyes. So this is very transparent, and what happens when this cornea loses its transparency or its shape, it affects the vision. So keratoconus is nothing but alteration in the shape of the cornea, where cornea becomes thinner and protrudes forward, thus deviating the light the way it goes into the eye, leading to decrease in the vision.
Okay. What are the symptoms of keratoconus and how do I know that I could have it?
The common symptoms with which patients present with keratoconus are decrease in vision, distorted vision, where the patient will see a deviation in image quality. 3, they usually complain of night vision difficulties, where they have more photosensitivity, and frequent change of glasses is one of the common symptoms as well. They have very high cylindrical power. In spite of correcting with glasses, their vision doesn't improve completely.
We understood what the symptoms could be. Now, once I see these symptoms, how do I know what's causing this?
Yeah, there's the very common causes nowadays that we see are allergy. Children associated with allergy who rub their eyes. And when you rub your eyes, the mechanical trauma that's happening on the cornea leads to a weakening of the cornea and then protrusion. There are some children who do not have allergies, but they are just habitual rubbers. So they keep rubbing their eyes once in a while. These are the ones who are more prone for keratoconus. And other habitual signs that we see nowadays is the sleep pattern. There are a few kids who sleep with their face down on the pillows. The chronic pressure of the pillow on the eye itself can lead to keratoconus. And the less common causes are genetic. If any of your family member has a keratoconus, so you can someone in the next generations can develop keratoconus. And if you are associated with some syndromes like Down syndrome or connective tissue disorders like the Ehlers-Danlos syndrome, there is a possibility of someone developing keratoconus. And we also see rarely that hormones have some influence. So we did see recently some young women who are pregnant develop keratoconus during the pregnancy, or they're having keratoconus and they showed signs of progression during pregnancy. So hormonal influence also can be there.
Well, that's very informative to know that if, as a parent, if I see my child rubbing my eye too often, I should see an ophthalmologist.
Yes.
Does keratoconus progress, and as an individual, why should I get it tested at the earliest?
Oh yeah, the keratoconus is a progressive condition. So when you diagnose it early, you have procedures where you can stop the progression of the disease. So in a recent study, we noticed that at least 15 to 20% of children required a procedure to stop the progression of the disease. Unfortunately, we also noticed at least 25% of the children who were diagnosed with keratoconus had at presentation a severe form of a disease, which we could have avoided if we had diagnosed this much earlier. So early diagnosis is very important. So we did publish a paper recently wherein we looked at detecting progression much earlier compared to the gold standard using artificial intelligence. So I think such technologies and such utilization of data can help us in future to detect the disease much early and also prevent progression of the disease.
And what are the treatment options that you offer for these different age groups?
Yeah, so when we look at treatment options, we look, because keratoconus is a progressive condition, we look at whether there is progression, there is a tendency for progression, or there is no progression, or there is no tendency for progression. The chances of progression is very high if you're very young, if you have a habit of rubbing your eyes. So in those cases, our goal of treatment would be to try to prevent the progression from happening. So we perform a procedure called collagen cross-linking, where we expose the cornea to ultraviolet rays and riboflavin, which is in vitamin drops. So this will lead to strengthening of the cornea, and this will delay the progression of keratoconus. And once we do the collagen cross-linking for visually rehabilitation these children, we give them glasses in very mild form of keratoconus. In moderate to severe form of keratoconus, we give them contact lenses. In patients where we notice that they're elderly, like for example they're about 30 and they've been having serial fallouts where there's no progression, so the need for collagen cross-linking may not be there in such situations.
You have mentioned about corneal transplantation. For our viewers, can you just inform us what exactly is this in a quick, brief fashion?
Okay, so corneal transplantation is one of the treatment options for keratoconus. So when someone has very advanced keratoconus where we cannot fit in a contact lens, I think we always incline towards performing a keratoplasty. Keratoplasty is replacing a diseased keratoconic cornea in a patient, and then we transplant it with a healthy cornea from a donor.
Okay, so it is very safe procedure if you come for corneal transplant.
Yeah, so keratoconus is a non-inflammatory disease, so the risk of rejection in keratoconus is less compared to other situations. So the success rate, I would say, is about 92% over a period of 5 years in this procedure.
Oh, that's incredible. That's a very good success rate.
Yes.
And what happens to people who are diagnosed with keratoconus? What kind of follow-up do you expect as an ophthalmologist?
So the follow-up depends on the age of the patient and associated risk factors. If I diagnose a child who's very young and have allergies, I follow them very closely. Every 3 monthly I see them to make sure the allergies are controlled, they don't rub their eyes, and their keratoconus is stable. And if I see someone above 20s and they do not have any other risk factors, we follow them up 6 monthly or annually after that.
Dr. Jatish, this is a question from all parents. As a parent, what should I be vigilant about?
That's a very good question and a valid one, Dr. Renuka. So, if a child has a habit of rubbing and if has recurrent episodes of eye allergies, I think these children needs definite treatment, so they need an ophthalmology consultation. Number 2, if anybody has a progressive form of cylindrical error, these children needs a cornea specialist to screen for a presence of keratoconus and look at the habits of children, like if their sleep posture is different and if they're putting pressure on the eye during their sleep unknowingly. I think these are the habits that we should change so that they don't develop corneal weakening or keratoconus in future. I think in the recent times, it's the mechanical pressure that is leading to keratoconus. So I think watching out of those habits is very important. So if you don't rub, there's no cone. So no rub, no cone.
Thank you for this informative session, and I'm sure our viewers have really benefited from this.
Thank you.